Hello, welcome to another Wellness Wednesday Q&A here on the Paso Norte Health Foundation's Facebook page. Today we're here with Paso Norte Health Foundation Senior Program Officer Enrique Mata and Texas Tech's Dr. Sarah L. Martin. She's the Chief of the Division of Child and Adolescent Psychiatry, and she's also an Assistant Professor in the Department of Psychiatry at Texas Tech Health Sciences Center here in El Paso. So Dr. Martin and Enrique, welcome to our Facebook Live. Dr. Martin and Enrique will share information today about the Child Psychiatry Access Network, or CPAN, project and take questions about child and adolescent anxiety and other mental health issues. We encourage you to submit your questions early in the comments here on Facebook Live, and we will answer as many as possible during this 15-minute live session. As always, we encourage you to visit epcovid19.org. That's your COVID-19 information hub for the Paso del Norte region. It was created by the Paso del Norte Health Foundation to help the community, you and your loved ones, find valuable resources to help get through the current health crisis. There's links and other resources for parents, students, businesses, mental health needs, and lots more there. It's in English and Spanish. And if you just go there to epcovid19.org, you'll find all the information and resources that you need. Again, welcome, Dr. Martin and Enrique. How are you guys feeling today?
Good.
Good, yes.
Good, thanks. Good to have you. So, Enrique, let me start off with you. Just a quick question to get started. How is the Health Foundation involved with mental health and wellness in the community?
Well, it's a good question. The Paso Norte Health Foundation has a mission to lead, leverage, and invest in initiatives, programs, and policies that promote health and prevent disease across the region, the Paso Norte region. And in that area, one of our health priorities, because we do know that mental health and emotional well-being are integral parts of the overall health and quality of life of individuals and families. So our focus is to help reduce that stigma and negative bias surrounding mental illness by getting the myths and facts out and clarifying things. And then also working collaboratively to help improve the behavioral health system of care by connecting folks and getting better continuity, better communication. So when folks do need to get help, they can get help in a timely way where and when they need it.
Okay. And as we mentioned, we do have the information hub online. Is there any resources that you can point people to there?
There are certainly resources, and we continue to add resources onto that list. As a matter of fact, if you click into the area where it says I'm feeling anxious, there's a good list of organizations in the community, and many of them have openings to see patients if folks want to get a preliminary assessment or ask some questions about their emotional health.
Great, that's good information. So again, we're here today with Dr. Sarah Martin from Texas Tech and Enrique Mata from the Health Foundation. If you have any questions you'd like to submit here on Facebook Live, feel free to drop them in the comments here, and we'll get to them as soon as possible. If this Facebook Live ends before we get to your question, we'll answer them in the comments. Dr. Martin, let me get to you. What is the CPAN project, and how has COVID-19 affected its work and its goals?
So the CPAN network it stands for Child Psychiatry Access Network. And what it is a hotline for primary care providers. So if a primary care provider has a patient in their own office, that one of their own patients that's having a psychiatric or psychological problem, then they can call us and we can help them get started on diagnosis, treatment, and even recommend like what type of screenings they might want to do. We're focusing on the basic, the most common diagnoses that kids present with. And we're hoping that every time that we talk to the primary care providers, they'll learn a little bit more. And so more and more kids will be able to get treatment in our community. And the reason that this all started was because there's a big shortage of child psychiatrists. So we don't want those kids waiting on a waiting list somewhere, sometimes for months, while they're having more and more problems. This way, as soon as they present to the very first provider that sees them, we can help them get started with an appropriate treatment, whether that be medication or therapy, that sort of thing.
It sounds like a really much needed project here in El Paso. So we all know that since COVID-19 has started, kids have been home since around spring break, so going on maybe past 2 months now. Um, have you already started seeing more cases of children who need some mental health care regarding either anxiety or any other issues with them being at home?
We have heard from certain organizations. We've been talking with some of the school districts locally because we have another project that is going to be telemedicine in the schools, and so we're trying to get those projects starting. We aren't getting a lot of extra calls for appointments in our clinics, but we are making sure to take care of the patients that we already have in our clinics that already have problems, especially with anxiety. Usually in a big crisis like this, you don't get a lot of need for mental health services in terms of psychiatry appointments and that sort of thing until later. Humans tend to do really well in a crisis, in the middle of a crisis, and they keep it together. And they take care of what they have to take care of. And then later on, the stress takes its toll. And so we usually, in long-term crisis situations, we usually see the need for increase in mental health treatment later on down the road, sometimes even a couple of years later.
So this is something we might need to be prepared for further down.
Right.
And what are some things that parents can look out for in their children as they move ahead? Since maybe right now they're still adjusting and they might see changes later. What are some things that parents could look out for?
Probably the most common thing that you'll see in a kid who is stressed is that they'll be irritable. They'll cry more easily, or they will lash out more easily, either with words or even with aggression, depending on the age of the child and the child's personality. But usually irritability is the first thing that you see when a kid's having trouble. And of course, we're as adults, we're irritable right now too, because our whole world has changed and the future is so uncertain. And it's so easy if somebody is irritable with you to, get upset with them back, but that's only going to escalate the situation. So if you do see that irritability in your kids, it doesn't necessarily mean they have a psychiatric problem. It could be that all they need is for everybody to calm down and to get a hug or whatever it is that comforts that kid the best way. And of course, it's so different depending on the age of the kid.
Right. And so getting to that comfort and, just being together with your family, if people are stressed or anything like that, something that Enrique always likes to touch on. We've had him here on the Facebook Live several times now since we started these. And one thing that he always likes to touch on is the power of kindness and the power of just, random acts of kindness and being together with your family. How is that a vital way that you can improve your mental health and your well-being?
Is that a question for me or for Enrique?
Yeah.
Okay. Yes. So it is such an important way, especially if I'm a child psychiatrist. So when I get asked questions, I mostly think of kids. But every kindness that you show your own child or someone else's child builds in that child more resilience. Kids are naturally resilient. But they really depend on adults for the cues on how to behave and how to feel and how to act. So the more honest we can be with them, and the more we can show kindness in the face of adversity, then the stronger that kid will be in the future. Mm-hmm. Every time, child abuse, of course, is a horribly depressing issue that a lot of people worry about. But a lot of bad things can happen to a child, but if they have someone there for them that can be kind and caring and compassionate and make that kid feel safe, then that kid can make it through a lot of hard times in the future.
And Enrique, did you have anything you want to add to that?
Well, certainly just, I love that Dr. Martin said that, because it just reinforces, I know how smart she is and how much she knows about this topic, but certainly that random acts of kindness not only help the individual, but they help those folks around you. It's kind of a pay it forward kind of thing, because if you can, check on your neighbor or even just make a meal together in your own home, those kind of things, working together on things and making good memories really does make a difference in people's emotional well-being.
Great. Okay. And so again, I just want to remind everyone that's watching that we're here today with Enrique Mata from the Health Foundation and Dr. Sarah Martin from Texas Tech, and we're talking about issues with child and adolescent mental health right now during COVID-19. Dr. Martin is also part of the Child Psychiatry Access Network. We talked a little bit about that before. What are some of the resources that people can find through CPAN, and how can they get help from CPAN if they want to reach out?
So we have a phone number that people can call. Now this line is specifically for primary care doctors, nurse practitioners, and PAs. The phone number is 888-901-CPAN. And so if you call that line, we can help you not only with diagnosis and medication recommendations, but also with who in your patient's community, neighborhood is taking new patients right now. So the idea is to get kids in as quickly as possible. And then during this COVID-19 time, it's going to be an even more important service, because anybody who's coming up with new symptoms, they might not be able to get in to see a psychiatrist in person. But even if they can have a phone appointment with their own doctor who they already know, or their own PA that they see, every year for their checkup, or their own nurse practitioner that they see every year for their checkup, or if they get the flu or something, they have that relationship already. And so then the stigma of having these symptoms doesn't prevent people from getting care as much. So we really want to support the relationship that primary care providers have with their patients, but at the same time, help them feel more comfortable to address even complicated psychiatric issues, because the providers, they can call about a certain patient, and then maybe the treatment that we recommended didn't go that well, it wasn't effective, or there was a side effect. Well, then they can just call us back, and we can go through the symptoms and what happened and give another set of recommendations. So it's not just a one-time thing that people can call. They can call us every day if they want. It's going to be open during business hours, and you can either call to sign up, or I know on the Paso del Norte website, there's probably the link to sign up and give us your information, because we're also going to have educational events, case conferences, that sort of thing. We were planning on doing all that in person, but it turns out everything's going to be electronic for a while, I guess.
Do you want to give us that number one more time, and then we'll also drop it in the comments here for people who are watching later?
Sure. It's 888-901-CPAN, CPAN.
Okay. We do have one question from the Facebook commenters right now. There's somebody asking, how do you explain to a child that might be a little bit frightened right now with seeing people wearing masks or having to wear a mask if they leave the house? What's some conversation you might have with your children about that?
Most kids, if they see their parent doing it, and the parent just gives a simple explanation, say, we're going to wear these masks so we won't get sick, and giving details depending on the age of the child, a lot of times that's all it takes. Because again, the kids are really looking to parents and other relatives that are taking care of them for how to act in this new situation. And, thinking from a kid's point of view, new situations happen every day. Things that we take for granted because we've seen it 100 times, it might be the first time they see it. And so in a lot of ways, something new happening doesn't throw off kids as much as it does adults. And so just telling the truth, we're wearing them because we don't want to get sick, and we don't want other people to get sick. And the more panic, of course, the parent shows, then the kid is learning in that situation that, okay, when something happens, you're supposed to panic. But then, of course, the opposite is true. If you stay calm in a situation like this, then you're teaching your kids that's how you act in a situation like this. You do stay calm, and that will be a gift that you give to your child that will last the rest of their life.
That's awesome. Before we wrap up here, we're getting towards the end of our time. Before we started this Facebook Live, we were talking a little bit between ourselves about different effects that we might see down the line regarding the lack of socialization that kids might have right now, and also the repeated crises that we've now seen in El Paso because of the shooting that happened last year and now COVID-19, which is actually a worldwide crisis. So we didn't really get to touch on some of that, but I think what you mentioned that it can give everybody a little bit of hope is the fact that children are very resilient. So I think that's something good for all our viewers to know and to keep in mind when they're speaking with their children and trying to help them manage this crisis. I don't know if either of you want to have anything to add on to that.
The more kindness we can give kids, the more resilient they will be, and the better everyone will get through this.
Great.
I think that's well stated, and I would just say ditto.
All right. Well, we are at the end of our 15-minute time that we try to allot for these Facebook Lives, so we don't take up too much time from people's lunch, even though they may be at home. But we do want to encourage everybody to join us here on the Health Foundation's Facebook page every week for our Wellness Wednesday live chats. We have a different topic each week that relates to some of the work that the Health Foundation is doing here in the community. I want to say thank you today to Dr. Sarah Martin for joining us, and to Enrique Mata as well for helping to facilitate this conversation. As always, we encourage you to visit epcovid19.org, which is a website in English and Spanish that contains a lot of valuable information and resources for the community while we're trying to deal with this public health crisis right now. So thank you very much for joining us on the live chat. If you have any more questions, feel free to ask them in the comments, and we will get back to you with an answer as soon as we can. Thank you very much, guys. Have a good day.
Thanks for having me. Bye-bye. All right. Okay, good. Yes, thanks for having me. Yeah. Hopefully people